Hi, hello everyone. This is Vamshi Krishna. Welcome to my YouTube channel. Today we are going to see some of the medical surgical nursing multiple choice questions. The first question is the causes of neurogenic shock may include all of the following except one. The options are option A pulmonary embolism, option B psychic trauma, option C surgery, option D spinal anesthesia. The right option is option A. So, among these four options, we can see neurogenic shock in psychic trauma, surgery, and spinal anesthesia. So, in case of pulmonary embolism, we cannot see neurogenic shock. The next question is which type of immunoglobulin consists 75 to 85% in the blood? The options are IgA, option B IgE, option C IgM, option D IgG. The right option is option D. So option D is the IgG. IgG immunoglobulin we can see 75 to 85% in our blood. The next question is what is the other name of gas gangrene? So gangrene means it is a type of cell death. So what is the other name of gas gangrene? The options are option A diabetic foot, option B septicemia, option C Clostridium myositis, option D candidiasis. The right option is option C. Clostridial myositis is other name for gas gangrene. The next question is the type of cells are those which constantly multiply throughout life, replacing those cells being destroyed. So, throughout the life, which are the cells multiply and replacing those cells being destroyed? So, after the cells which are destroyed, so in that same place, which type of cells are producing new cells, forming the new cells? The options are option A bone cells, option B labile cells, option C stable cells, option D permanent cells. The right option is option B. Labile cells are the cells which constantly multiplying throughout the life. So those cells are the labile cells are the under continuous active division and replace the cells that are lost from our body. So these are the cells which continuously active in division. Division in the sense cell division and replacing the new cells. For example, the labile cells are epithelia of ducts, hematopoietic stem cells and epidermis. So in these areas we can see labile cells. The next question is in stress the sympathetic adrenaline mechanism is activated and it is achieved through. So in the case of stress the sympathetic adrenal mechanism will be activated. So that mechanism how it going to be happen? The options are option A thyroid hormone, option B mast cells, option C epinephrine and norepinephrine, option D B lymphocytes. The right option is epinephrine and norepinephrine. So in the case of stress we can see through the epinephrine and norepinephrine of sympathetic adrenal mechanism will be going to happen. The next question is which type of shock occurs due to failure of heart to pump? The options are septic shock, option B cardiogenic shock, Option C, hypovolemic shock. Option D, neurogenic shock. The right option is option B. Cardiogenic shock is occurred due to the failure of pumping of the heart. The next question is why gamma globulin preparation is not administered through intravenously. So the gamma globulin preparations are the fluids or injections which are not administered intravenously. That is why. The options are option A, it is not effective. Option B, it is thick preparation. Option C, large quantity. Option D, thick preparation causes severe anaphylactic reaction. The right option is option D. It has the thick preparation. Preparation means consistency and it causes severe anaphylactic reaction. Anaphylactic reaction is nothing but antigen antibody reactions. The next question is large amount of citrated blood given over a short period of time causes. So when we give to the patient that is citrated blood to the patient in a short time, so what will happen in the patient? The options are option A hypercalcemia, option B hypocalcemia, option C hyponatremia, option D hyperkalemia. The right option is hypocalcemia. So when we give to the patient that is high amount of citrus blood, the hypocalcemia will be occur. The explanation for this question is the major anticoagulant used in blood product collection and storage. So in the blood product, high amount of anticoagulant is used. So when we use a anticoagulant like heparin or some other products to prevent the blood clotting, so that is called citrated blood. And this citrated bind to free calcium and prevent it from from interacting with the coagulation systems. When the citrate bands are connected with the calcium ions, it prevent the interaction with the coagulation system, so it prevent occurring of clots. So citrate work great to keep our blood products from clotting. It is preventing the clotting of blood so that the patient will have the hypocalcemia. The next question is which of the following factor is not affecting the healing process? The options are option A hormonal influence, option B color of the skin, option C age, option D foreign bodies. The right option is color of the skin. So it is not depend on the healing process of the color of the skin. The next question is an inflammatory response to a pathogenic organism is termed as. The options are infection, option B inflammation, option C anaphylaxis, option D allergy. The right option is infection. So when the pathogen are enter into the body, the inflammatory reaction will be start. That is called infection. The next question is if bacteria spread from local site to the bloodstream is known as. When the person having the injury over the body, when it is that injury microorganisms which are present in the wound which are enter into the bloodstream, what we call that. The options are option A bacteremia, option B septicemia, option C toxins, option D secondary infection. The right option is bacteremia. When the local bacteria enter into the body, enter into the blood, it is called bacteremia. The next question is transplant rejection is an example of. So, when the person having the transplantation of any organ, so when that organ is rejected from the body, so what we call that type of rejection? The options are option A type 3 hypersensitivity, option B type 2 hypersensitivity, option C type 1 hypersensitivity, option D type 4 hypersensitivity. The right option is option D. Option D is the type 4 hypersensitivity we can see in the patient that who have rejected the body organ. The next question is the characteristic smile present in tetanus due to the stiffness of neck and spasm of facial muscle is known as when the person having the tetanus infection. So the person will have the stiffness of neck and spasm of the facial muscle. Spasm means there is no movement of the facial muscle. So in that patient, what is the characteristics of smile? The options are option A opistonosis, option B lockjaw, option C moon face, option D rhizus sardonicus. Rhizus sardonicus is the right option. So option D is the right option. The next question is which of the following is a wrong statement about Clostridium tetani? The options are it is a comma shaped bacteria. Option B it is a anaerobic bacteria. Option C it is gram positive bacteria. Option D it is spore forming bacteria. The right option is option A. It is a comma shaped bacteria. So the comma shape is like this. So tetani, Clostridium tetani has the comma shaped bacteria. The next question is which of the following is not a factor influencing inflammation? The options are option A adequacy of blood supply, option B nutrition, option C age, option D sex. The right option is option D is the sex. Option D is the right answer. So in the case of inflammation, there will be the relation of adequacy of blood supply, best nutrition, and age. So these three are the true, and this one is the false. So in the case of sex, we cannot see any difference in the inflammation. The next question is what is the full form of TIGH? TIGH. The options are option A time, incidence, goal, and hormone. Option B none of this. Option C tetanus, immunoglobulin, and human. Option D total intake of growth hormone. The right option is option A. Sorry. The right option is option C. Tetanus immunoglobulin human. The TI is full form is tetanus immunoglobulin human. The next question is tuberculin reaction is an example of. The options are cytotoxic reaction, option B immune complex reaction, option C anaphylactic reaction, option D cell mediated reaction. The right option is cell mediated reaction. Option D is the right answer. The next question is, which immunoglobulin is known as macroglobulin? Macro means big, bigger in size. The options are option A IgG, option B IgM, option C IgD, option D IgA. The right option is option B. Option B is the IgM is the big immunoglobulin. The next question is, a patient tells you that her urine is starting to look discolored. Discolored means it is not like pale yellow color. So, if you believe this change is due to medication, so if you understand this reason is due to the medication of the patient. So, which of the following patient's medication does not cause urine discoloration? The options are option A sulfasalazine, option D levodopa, option C phenolphthalein, option D aspirin. The right option is option D. Aspirin is not the cause for the urine discoloration. The next question is, you are responsible for reviewing the nurse unit's refrigerator. So, if you found the following drug in the refrigerator, it should be removed from the refrigerator contents. So, if you see these four drugs in the refrigerator, so which drug is should not keep in the refrigerator? The options are option A Corgat, option B, humulin, option C, urokinase, option D, apogen injection. The right option is Corgat. Corgat is a drug of choice in the case of hypertension. The next question is, a 34 years old female has recently been diagnosed with an autoimmune disease. So, she has also recently discovered that she is pregnant. So, which of the following is the only immunoglobulin that will provide protection to the fetus in the womb? The options are option A IgA, option B IgD, option C IgE, option D IgG. The right option is IgG. So IgG is the only immunoglobulin which crosses the placenta and it will protect the fetus from the infections. The next question is, a second year nursing student has just suffered a needle stick while working with a patient that is positive for AIDS. So, when the second year nursing student is working with the positive AIDS positive patient, so which of the following is the most important action that a nurse student should take? The options are option A immediately, C a social worker, option B start prophylactic AZT treatment, option C start prophylactic pentamidine treatment, option D seek counseling. The right option is option B. So the nurse student should take the zidovudin treatment. So that is AZD treatment. The next question is, a 35 years old male has been an insulin dependent diabetic for 5 years and now is unable to urinate. Which of the following would you most likely to suspect? The options are atherosclerosis, diabetic neuropathy, autonomic neuropathy, somatic neuropathy. So, what may be The neuropathy in the case of diabetes. The right option is option C. Autonomic neuropathy we can see in the case of diabetic patient and also having unable to urinate. The next question is, you are taking the history of a 14 years old girl. So who has a BMI of 18? The girl reports inability to eat, induced vomiting, and severe constipation. So, which of the following would you most likely to suspect? So, the girl having the 14 years of age and BMI is 18. 18 means very low. And also, the girl having inability to eat and induced vomiting. Induced vomiting means voluntarily going for the vomiting and expel the gastric content and severe constipation. So, what may be the reason behind this problem? The options are option A multiple sclerosis, option B anorexia nervosa, option C bulimia, option D systematic sclerosis. The right option is option B. Anorexia nervosa is a psychiatric condition that people having inability to eat and induced vomiting and severe constipation they may have. The next question is, a 24 years old female is admitted to the ER for confusion. So, this patient has a history of myeloma. Diagnosis: constipation, intense abdominal pain, and polyuria. So, which of the following would you mostly likely to suspect? The options are diverticulosis, option B hypercalcemia, option C hypocalcemia, option D irritable bowel syndrome. The right option is hypocalcemia. Hypocalcemia cause for the confusion in the people and they will have the memory loss and abnormal brain functions. The next question is, a patient has taken an overdose of aspirin. Which of the following should a nurse most closely monitor for during acute management of this patient? So, overdose of aspirin medications. So, what is the uh, primary care for the patient by the nurse? The options are onset of pulmonary edema, option B metabolic alkalosis, option C respiratory alkalosis, option D Parkinson disease type symptoms. The right option is option D. So, in the case of overdose of aspirin medication, we can see Parkinson disease type of symptoms in the patient. The next question is, a 50 years old blind and deaf patient has been admitted to your floor as the charge nurse. So, that is in charge nurse, your primary responsibility for this patient. So, when the patient is having blind as well as deaf means unable to hear the voice. So, if you are the in charge of that floor, what is your first responsibility towards the that patient? The options are let others know about the patient's defects. Option B communicate with your supervisor your concern about the patient defects. Option C continuously update the patient on the social environment. Option D provide a secure environment for the patient. The right option is option D. We need to provide a secure environment for the patient from external injuries. The next question is, a patient is getting discharged from a SNF facility. So the patient has a history of severe COPD and PVD. The patient is primarily concerned about their ability to breathe easily. So, which of the following would give the best instruction for this patient? COPD means chronic obstructive pulmonary disease. So, in the case of this, what is the primary concern? The options are option A, deep breathing techniques to increase the O2 levels, option B, cough regularly and deeply to clear airway passages, option C, cough following bronchodilator utilization, option D, decrease carbon dioxide level by increasing oxygen take output during meals. The right option is option C, cough following bronchodilators utilization. The next question is, a nurse is caring for an infant that has recently been diagnosed with a congenital heart defect. So, which of the following clinical sign would you most likely to be present? The options are slow pulse rate, option B, weight gain, option C, decreased systolic pressure, option D, irregular WBC lab values. The right answer is option B. So, in the case of a child with a congenital heart defect, it may cause for edema over the body so that the child can have the weight gain. The next question is, a patient has recently experienced a MI, myocardial infarction. So within the last 4 hours. So which of the following medication would you most likely to be administered? The options are streptokinase, option B, atropine, option C, acetaminophen, option D, coumadin. The right option is streptokinase. Streptokinase is the drug of choice in the case of patient with within 4 hours of myocardial infarction. The next question is, a patient asks a nurse, my doctor recommended I increase my intake of folic acid. What type of foods contain folic acids? The options are option A, green vegetable and liver, option B, yellow vegetables and red meat, option C, carrots, option D, milk. The right option is green leafy vegetables and liver, so which consists higher amount of iron. The next question is, a nurse is putting together a presentation on meningitis. So, which of the following microorganisms has not been linked to meningitis in the humans? So, which of the organisms which are not related to the meningitis in the humans? The options are option A, S pneumonia, option B, H influenza, option C, N meningitis, option D, CA difficile. The right option is option D. So CA difficile is a not cause for the meningitis in the humans. The next question is, a nurse is administering blood to a patient who has a low immunoglobulin count. The patient asks, how long to RBC last in my body? So, this means what is the lifespan of RBC cells? The options are option A 45 days, option B 60 days, option C 90 days, option D 120 days. The right option is option D. The lifespan of red blood cells is 120 days. The next question is, a 65-year-old man has been admitted to the hospital for spinal stenosis surgery. When does the discharge training and planning begin for this patient? The options are following surgery, option B upon admit, option C within 48 hours of discharge, option D preoperative discussion. The right option is upon admit. When the patient is admitted, at the time only the doctor or medical advisor has to explain about the discharge training and planning. The next question is, a child is 5 years old and has been recently admitted into the hospital according to Erickson. Which of the following stages is the child in? The options are option A trust versus mistrust, option B initiative versus guilt, option C autonomy versus shame, option D intimacy versus isolation. The right option is option B. When the child is having the 5 years 5 years of age, we can see initiative versus guilt according to the Erickson theory. The next question is, a toddler is 16 months old and has been recently admitted into the hospital according to Erickson theory. Which of the following stages is the toddlers in? The options are option A trust versus mistrust, option B initiative versus guilt, option C autonomy versus shame, option D intimacy versus isolation. The right option is trust versus mistrust. The next question is, a young adult 20 years old has been recently admitted into the hospital. According to Erickson theory, which of the following stages is in the adult? The options are option A trust versus mistrust, option B initiative versus guilt, option C autonomy versus shame, option D intimacy versus isolation. The right option is option D, intimacy versus isolation. The next question is, a nurse making a rounds taking vital signs of the some of the patients. So, which of the following vital signs are abnormal? The options are option A 11 years old male, that is 90 beats per minute, 22 respirations per minute, 100 by 70 mm of Hg, that is blood pressure. Option B 13 years old female, 105 blood BPM, 22 respirations, 105 by 60 blood pressure. Option C 5 years old male, 102 BPM, 24 respirations, 90 by 65 mm of Hg, that is blood pressure. Option D, 6 years old female, 100 bpm, 26 respirations, 90 by 70 blood pressure. The right option is option B. Option B is the right answer, but these values are the wrong values. The next question is, when you are taking a patient history, she tells you she has been depressed and is dealing with an anxiety disorder. Which of the following medication would the patient most likely to be taking? The options are option A, Elavil, option B, calcitonin, option C, pergolidin, option D, verapamil. Verapamil. The right option is option A, Elavil. So, when the patient is taking Elavil, mostly the patient will have depression. The last question is, which of the following condition would a nurse not administer erythromycin? The options are option A, campylobacterial infection, option B, legionary disease, option C, pneumonia, option D, multiple sclerosis. The right option is option D. Option D is the right answer. That is multiple sclerosis. In the case of multiple sclerosis, we should not administer erythromycin drug.